Perfect. So thank you, Dr. Villano, so much for joining us for the session today. We are so happy you're here. I know we have a lot of questions already coming in. And we also have two other experts with us, Dr. Kay, who's our System Medical Director of Infectious Diseases, and Vincy Samuel, our Director of Employee Health. So I'm happy to have everyone on the call today. We're excited to be able to answer your questions, and we appreciate your time.
Thanks, Wesley. Hopefully you guys can hear me. Just let me know if you can't. I'm Kathryn Villano. Just to introduce myself, I'm one of the maternal fetal medicine physicians at Baptist, and I actually work at most hospitals in town, not just Baptist, but all the systems. I'm thrilled to be here talking to you guys. I know this is a question that a lot of patients have as far as vaccine, in pregnancy, breastfeeding, fertility questions, all of those things. And I'm so honored that you guys would join us and listen in on what information we have to share and give me the opportunity to answer whatever questions I can for you guys. So thank you.
Perfect. So we'll let you kick it off. Just talking a little bit in general about what you've kind of seen, what you've been able to learn, what research has showed us for the past few months. And then we will hop into people's questions. So we did receive some questions before today's event, which I'll ask those first. And then you're welcome to submit a question in the chat, or we'll give you some time to unmute since we have a lot of call-in users today to ask a question. So let's get started.
Sure. So, just to start off, one question that I get a lot from my patients, and the question has definitely changed over the last few months is, am I really at risk for getting sick with COVID? In the beginning of the pandemic, we were seeing a lot of patients that were getting sick who were older, who had multiple comorbidities. Younger, healthier, pregnant women were feeling a little more safe, not as at risk for getting severe COVID. Um, we know now with the onset of the Delta variant that our demographics have changed quite a bit of who is getting sick. And the new version of COVID doesn't seem to care if you're young and healthy anymore. It is definitely affecting a lot of our patients who are younger, healthier, don't have a lot of comorbidities. And we now have a lot of data on how pregnant women do with COVID. When you're pregnant, obviously your body is supporting two people, and there's a lot of changes that take place, especially in your respiratory system. Your ability to breathe changes, your lung capacity changes, your immune system changes. And that's been translating to in the last few months is that we're seeing a lot more pregnant ladies getting severely ill with COVID. The data has shown us that if you're pregnant and you get COVID, you're about 3 times more likely to need to be hospitalized, about 3 times more likely to need ICU care. And unfortunately, our death rates are higher in our pregnant ladies than other women who are not pregnant and are similar as far as medical problems and age go. So pregnancy itself is a risk factor for severe COVID, and that's certainly getting a lot of people's attention who across the country that take care of pregnant moms. So obviously with the vaccine coming out and being offered initially to medical care workers and then offered to the general public, we have been gathering data on how our pregnant women do with vaccination. And most of you may be aware that the CDC came out with a strong recommendation that pregnant women be vaccinated. And a lot of people ask me, well, why is that now? Why do we know this, is safe now? And so I'm happy to go over a lot of that data with you guys. Since they started vaccinating patients back in January, almost a year ago, not quite, we've had about 155,000 pregnant women vaccinated, and they are following outcomes on those patients and doing research and looking very carefully at how they do. In theory, the vaccine should be safe, which is why we offered it to pregnant patients in the first place. If we're talking about the mRNA vaccine, Pfizer or Moderna, that mRNA molecule gets injected into your arm, and the muscle cells there produce the spike protein that your immune system recognizes as foreign and says, this is a foreign protein. I'm going to make some antibodies against this. That mRNA dissolves and goes away. It doesn't last any length of time. And it's such a big molecule that it doesn't cross the placenta. Even if some got into your bloodstream, it's not going to cross the placenta and actually enter baby's bloodstream. So it's working in mom's body, not baby's. So when your body sees that protein, it makes antibodies. If your body then sees COVID, which has the matching protein on the outside, those antibodies will attack the COVID virus and prevent you from getting as sick as you would have had you not had the vaccine. The antibodies themselves can cross the placenta. When you're pregnant, your baby gets the benefit of all of your antibodies. So, whatever you've had in the past, whether it's chicken pox, the flu, a cold, any number of viruses you had somewhere along your lifetime, your body has made antibodies against those, and they stick around. And those antibodies do cross the placenta and provide baby some protection in those first few weeks of life. They don't last forever because they're your antibodies. They're not babies. Babies just borrowed them from you because they've crossed over. So they do last for a few weeks, and then we think they go away. By that time, baby's immune system is working a little bit better. So we know that we can pick up COVID antibodies in baby, but we don't see any reason why the vaccine molecule itself would be able to cross the placenta. So scientifically, the design of the vaccine is in theory a super safe design. So then the next step after we say, okay, the design of this vaccine is good, now let's look and see how people really did with this. So we have a lot of data on a large number of women that have been vaccinated all across different ages in pregnancy. And I can share that with you guys today. I'll take a minute and I'm going to share my screen because this is a super common question. If I was pregnant, I would want to know, okay, what might the vaccine mean for me and my pregnancy and my baby? So, when you're pregnant, there's always a risk of complications. Even in the healthiest mom, we know things happen like preterm labor, gestational diabetes, growth issues for babies. Those are not uncommon complications to have. That's why you get prenatal care. That's why you see your OBGYN. So when we look at data for our moms who are vaccinated, what you should see on the screen is the V-Safe pregnancy outcomes, looking at all of the women that have been vaccinated thus far. So the background rate in this table, this is the reported rate of these complications in the general population of pregnant women, not high-risk women, average women. So the background rate for gestational diabetes is between 7 and 14%. V-Safe vaccinated patients are right in the middle of that. As far as preeclampsia, high blood pressure, still in range for that. Risk of eclampsia, which is a complication that develops in pregnancy where moms have seizures as a result of high blood pressure. That was 0 in our population, so definitely not an increase there. Growth restriction, meaning a baby that's not growing as well as it should. We're actually looking lower in our vaccinated population. Scrolling down, if we look at rate of preterm birth, still in range here. Fetal anomalies, this is a big question. Could somehow that mRNA, reach my baby and cause something to change as far as development goes? Doesn't look like it at all. We're still within range on what's normal in the general population. Babies being small when they're born, still within range, and risk of baby passing away after birth, what's called neonatal death, is very, very low. We're getting a 0% right now. So all of this data looks at the common complications that we see in pregnancy, and we don't see any increase. We haven't seen any bump in those complications in our women who have been vaccinated. So that's very, very reassuring. Hopefully you can see me again. Um, One of the questions I get the most is, how would this vaccine impact my baby's health? The main way it impacts your baby's health is by keeping you safe and preventing you from getting sick from COVID and putting you at risk for some of those complications that we're seeing in our pregnant moms. What we are seeing as far as COVID and pregnancy is a lot more pneumonia in our moms who get sick. They seem to have more respiratory complications than the general population. And because we know that COVID can cause clotting problems, can people with severe COVID can get clots in their lungs and other places. We're seeing more of that in our pregnant moms. And when they do get sick, sometimes we do have to deliver them early to be able to help mom breathe and help her recover and to keep baby safe. Because if mom can't breathe and get good oxygen levels herself, neither can baby. The biggest benefit to the vaccine is keeping mom and baby safe and preventing them from getting severe COVID. The risks are not super high. We don't think there's a risk to baby. We don't think that we're seeing any more complications for pregnant ladies who are vaccinated. Of course, there's always a risk of complications or adverse reactions when you do get a vaccine. But when we look at the data for the COVID vaccine, those risks are really, really tiny compared to the potential benefits there. And we are lucky we have an infectious disease expert on, Dr. K, I think they call you for short. And I'm happy to let her talk a little bit about risks of vaccination, or I can too. But I'm going to pause for a second and see what questions you guys have about data and pregnancy.
Thank you so much, Dr. Villano. That was great. If anyone wants to unmute themselves who are on the phone, or if you want to type in the chat, I'd be happy to read your question out. Let's kick it off with a question we had submitted before the event. So, um, this is a question, how long after giving birth should you wait to have the vaccine? And while breastfeeding, do you need to wait any certain amount of time after receiving the vaccine before you can nurse the baby?
Good. That's a great question. So, breastfeeding wise, and that's another common question I get, is it safe with breastfeeding? Um, you can absolutely get vaccinated while breastfeeding. The mRNA, like I said, it's going to work in your muscle. mRNA is a big molecule, so we do not anticipate that it can cross into your breast milk. Even if it crossed into your breast milk, it's a protein, and milk is full of proteins. When we are a baby or a grown up and we drink milk or eat protein, what do? We digest it. So those mRNA molecules don't stay intact. They actually get digested and eaten. And anytime we're eating an animal protein of any sort, we're eating some mRNA. So there's no way that the vaccine would pass from mom through breast milk to actually work in baby. So very safe vaccine to receive while breastfeeding. I wouldn't recommend any particular length of time to delay vaccination. Obviously, we're saying that we'd like our pregnant moms to get it while pregnant. If you haven't received it and you give birth, I'm I think it's something that you can get right away because, again, we want to keep you and baby safe. And with our prevalence level, particularly with Delta variant in Jacksonville being so high, the risks are significant right now. Hopefully that answers that question. It's a
Perfect,
good
thank you. So
one.
you talked a little bit about the vaccine being able to not go through breast milk. Can you talk a little bit about the antibodies and what we know
Mhm.
about how that might benefit baby?
Right. So those antibodies can cross the placenta while baby's in the womb. And so baby will be born with some of your antibodies in their bloodstream. Babies do get some antibody protection from breast milk. It's not a tremendous amount. Most of what they get in breast milk is an IgA antibody, which is not as strong as the IgG antibodies that we're making when we give a vaccine or we actually get an infection. Our bodies make those in response to infection as well. So, IgA antibodies are a little bit of a protection. They coat baby's throat and stomach and some of their nasal passages to prevent infection. But it's as far as getting a ton of IgG antibody, the real strong antibody for COVID through breast milk, you're not going to get a ton of that. So the protection that we think babies get from moms being vaccinated lasts a few weeks while mom's antibodies are still working in baby, and then it wanes and goes away. So your baby, unfortunately, we can't say that we're making super COVID immune babies when we vaccinate moms. We're not.
Perfect, thank you. So Dr. K, I'll turn it over to you for this question. Can you talk a little bit about booster vaccines in general, what we know right now, what we think might be coming, and booster vaccines in pregnancy?
Sure, absolutely. So booster vaccines, there are two different buckets. So one is for immunocompromised patients. So that's anyone who's had a transplant, HIV, or is on immunosuppressive medications, and there's a list, or anyone who a doctor thinks has a weakened immune system. And those individuals would get the third dose or the third vaccine 1 month after the second. And that's to give them maximal immunity because in many studies, they didn't develop that immunity after just two. So that's already been approved by the FDA. What's coming in the near future, and by near, I mean like it could be next week or the week after, is that we might hear a recommendation for the entire public, the entire American public, to get a vaccine 8 months or 6 months after they finished that series. So that might be quite soon for individuals who started getting the vaccine in the December, January timeframe. We're still waiting on more word for that. We're waiting on when exactly it'll happen, meaning is it 6 months after the first series or 8 months? We're waiting on instructions on who should go first. Should it be, healthcare workers, nursing home residents? How is the rollout going to play out? But that is also something we should look to. And then if that happens, right now, while pregnancy is a precious category, and we have Dr. Villano here, it would be the exact same as for anyone else. So if the U.S. recommends boosters up 6 to 8 months after for anyone else, it would be the same for pregnant women.
Wonderful, thank you. So let's talk a little bit about fertility. Do fertility rates go down if you're vaccinated?
That's a great question. The answer is no. We have good data that says our vaccinated people are getting pregnant at the same rate as anyone else. Um, and it's unfortunate that that rumor got started on through social media. The basis of the rumor was that a protein called syncytin 1 shared a lot of similarities to the spike protein that we were targeting for COVID. Um, in reality, that's not actually true. Syncytin 1 is a protein that is made in the placenta, and it has about, I think, 538 amino acids in it. The spike protein that we're targeting has over 1,500 amino acids in it. And between all of those amino acids, they share one series of five. So five amino acids in the same order in all of those amino acids. So what that means in plain terms is that the proteins don't look at all alike to your immune system. It's kind of like mistaking a mouse for an elephant because they're both gray, but we would never mistake those for each other. They have so many different features that we wouldn't make that mistake ourselves. And the immune system is similar. A series of 5 amino acids is not a significant enough similarity for your immune system to attack that other protein. So we've proven that in vitro, and they've been doing studies on fertility rates in our vaccinated patients, and we're not seeing any decreased fertility. And if you think about it, it makes sense because our patients that get COVID, the actual illness, if they got an antibody against the spike protein, you would expect them to have decreased fertility rates too, but they don't seem to either. There is some data about men having lower sperm production after COVID infection, and that's because the cells in the testes and the Leydig cells that make sperm have one of the receptors that COVID particularly likes. So one of the complications that men can get with COVID is orchitis or epididymitis, if I say it right, because I'm not a urologist, which is inflammation in those tissues where sperm is made. So they do see some decreased sperm count in men who have COVID infection. They think it's probably temporary. But nonetheless, if anything, we have data that actual COVID may be more of an impact on fertility than the vaccine itself. My other concern would be if you're thinking about getting pregnant and you want to, have a baby in the future, um, getting sick with COVID may give you some lifelong after effects. We're still seeing the effects of what we call long COVID and some patients with some longer standing medical issues as a result. So, if you want to keep yourself as healthy as possible to carry that pregnancy, I would recommend vaccinating.
Perfect. Thank you. What's the best time during your pregnancy to receive the vaccine?
That's another good question. When we look at data from the CDC, there doesn't appear to be any better or worse time to get vaccinated. They did do a look at first trimester moms because our first trimester moms always, are worried about the risk of miscarriage. If I get the vaccine and I run a fever, is that going to be a problem for baby's development? And they looked at about 885 pregnant women who got the vaccine in the first trimester, and there was no increased risk of miscarriage. So that's very good, reassuring data. And as far as timing goes, I don't think there's one time that is any better than any other time. Some of the side effects that we see with the vaccine are very similar between pregnant patients and not pregnant patients. I can share some of that data with you guys too if you're interested. So what we're looking at are the side effect profiles of the vaccines. So Pfizer is up top, Moderna is down at the bottom. And probably as most of you know, with the first vaccine, the major side effect is usually a sore arm. There are some people that get fatigue, some headaches, muscle aches, chills, and a small number that get a fever. And with the second vaccine, we see a few more side effects. That's because your immune system is definitely revving up and getting you up to that full immunity that we're looking for, that 95% effective rate. So we might see more of those side effects. What this graph is showing is the side effects in pregnant ladies versus not pregnant ladies. And so we're seeing a little bit more of a sore arm, but actually less of the systemic side effects in our pregnant moms for both Pfizer and the Moderna vaccines. So that's great. What that tells us is you're no more at risk for having side effects because you're pregnant when you get vaccinated. The major side effects that a lot of people are concerned about as far as anaphylaxis or myocarditis, those risks are super, super low. It's on the order of maybe 5 to 10 people per million vaccinated. So if you're looking at, balancing risks. What are the odds of me having a really serious reaction to being vaccinated? It is super, super low compared to the potential risks of COVID.
Thank you so much. I know it's 12:58, but we'll keep moving into the 1 o'clock hour a bit since we started late because of the meeting password. So, next question. Some moms are concerned about the long-term effect of vaccinations in the baby as they grow up. We still don't know this data. Can you talk a little bit about that?
Sure. As far as long-term effects of vaccination, again, you're right. We don't have data for 5 years from now or 10 years from now. And what we're doing right now when we make recommendations to vaccinate pregnant women is looking at the risks and the benefits. When we have a vaccine, and I'm specifically talking about Pfizer or Moderna, where we know the vaccine is not going to be active in baby's system in the womb, we wouldn't expect that to have any consequence as far as baby's growth and development. On the flip side of that, if we get COVID in pregnancy, we're seeing a lot more growth restriction, even in our moms who have mild COVID. There seems to be some inflammation in placenta tissue that is slowing growth curves down. So we need to monitor those moms for growth. And if your oxygen levels are low, that can definitely have an impact on baby's growth and development as well. So, um, are we going to have data for 5, 10 years from now? No, we cannot fast forward time. I wish we could. Are we going to track it? Absolutely, we're going to track it. And to be honest, we've never had this much data on a vaccine in pregnancy ever. For those of us who do perinatal medicine, this is exciting for us because we're actually seeing a lot of research on our pregnant moms, which typically what we've done in the past with our other vaccines is look at the science of it, decide scientifically, can that vaccine impact babies' growth and development? Is that something that can cross the placenta? There are some vaccines we don't recommend in pregnancy, ones that use a live virus, we don't. But this one mechanically and medically speaking should be safe. The data is looking like it's safe. And thus far, our outcomes are looking really, really good. So we don't have 5 years, 10 years from now, but I don't even think there's that data on the flu vaccine, which we know we give to pregnant ladies because flu is much more dangerous for pregnancy. I hope that answers the question. Yeah.
Yes, excellent. So a question we also received beforehand, do I need to avoid my newborn if I start experiencing symptoms after the vaccine?
So if you're having routine side effect symptoms, and we think it's related to the vaccine itself, no, you certainly don't have to avoid your newborn. If you think your symptoms might be a symptom of COVID, we would want you to get tested. And most pediatricians are recommending that if mom suspects she may have COVID, that she try to avoid direct contact with baby for a period of time while she gets tested. And I would certainly encourage you to talk to your pediatrician if you think you might had symptoms of COVID and you're caring for a newborn. They're going to be the best person to advise you on that. But that being said, if the symptoms are classic side effect symptoms of the vaccine, you wouldn't need to avoid your baby at all.
All right. So if you are, if you've had high risk pregnancies in the past or you're told you have a high risk pregnancy, do you still recommend the vaccine?
Absolutely. There's different reasons for people to be high risk. Um, High risk can be there's an issue going on with baby, and baby may have some special needs after birth. And some of my moms who are expecting kiddos with medical issues that are going to have them in the hospital for longer periods or have them in our neonatal ICU have asked me, should I get vaccinated for COVID? And the answer is definitely yes. We want to keep parents safe to support those kids, and we also don't want to invite COVID into the hospital, into the newborn ICU. So it's definitely something you can do to help protect your baby if you have a baby that's going to have special needs. The other side of that is sometimes our moms are high risk because they have their own medical problems, diabetes, high blood pressure. Those are also risk factors for severe COVID. So our moms with underlying medical conditions, we're definitely encouraging them to be vaccinated.
Thank you. This is a good question. So there's been an increase in strokes in young vaccinated women. Any correlation studies that you're aware of and that you can share? This is from a neuro RN, so while it may be circumstantial, she says it's hard to ignore.
Right. Most of those cases, I think, were with Johnson and Johnson, and so part of why I would recommend an mRNA vaccine, Pfizer or Moderna, in pregnancy is as a result of that data. That vaccine works in a very different way than the mRNA vaccines do.
Perfect. Dr. K, anything to add on that? I saw you nodding.
No, that was actually perfect. That anyway, the recommendation is for an mRNA, and those are not necessarily those haven't been correlated with stroke or neuro findings.
Perfect. Well, again, 30 minutes goes by so quickly when we're learning from all of you, but thank you to everyone who was able to join us today. Dr. K has graciously offered to have one-on-one consults with anybody who may have questions or answer questions via email. So you're welcome to email her at her BMC Jax email address, and it's also listed in our FAQs that are on the exchange. Links to all these studies from Dr. Villano are also on the exchange. Amazing resources. I know a lot of you are asking for the data and the specific studies, so she's provided that information for all of us. So we're getting some thank yous in the chat, and a huge thank you to all of you for being here with us today.
Oh, thank you guys. This was, something I'm thrilled to do and happy to answer questions. I think it's very important that we try and be as transparent as possible about what we know, about what we don't know. I think, the American College of OBGYN, Society for Maternal Fetal Medicine, and CDC did their due diligence in looking at data before they came out with the recommendation to definitely recommend vaccination in pregnancy. So I am proud of our organizations and leadership nationwide that has looked very, very carefully. And if you are interested in looking at that, like Wesley said, she's posted some links to a lot of the studies that they're looking at to make these recommendations with.
Perfect. Thank you all so much. I know I'm seeing a couple questions about the studies on fertility, so I will touch base with Dr. Villano and we can add anything that she referenced that isn't already included. So
Yeah, I've got a
wonderful.
few more references we can throw in there for that.
Perfect. We love it. Thank you so much, everyone. Have a great rest of your day.
Thank you.